supplementation of oil palm phenolics in normal healthy volunteers. Thank you.
Thank you very much, Prof, for the introduction. Ladies and gentlemen, since 2 p.m. today, we have been listening to several presentations from our phenolic research team from MPOB, MIT, University of Brandeis, and CISRO. They're discussing about the physiological properties of oil palm phenolics based on in vitro and animals models. So what would I share with you this afternoon is about the recent clinical findings from our first clinical trials on oil palm phenolics. So the title of the presentation is Supplementation of Oil Palm Phenolics, OPP in Normal Healthy Human Volunteers. This actually was a phase 1 human clinical trial investigating the physiological properties of oil palm phenolics. So in MPOB, myself, Dr. Liao Sun Sen, Dr. Tan Yu Ai, and of course the overall OPP program coordinator, Dr. Ravikal Devi, was involved in this clinical trial. From UKM, the medical faculty of University Kebangsaan Malaysia, we have Dr. Isa Naina Muhammad, who acts as a medical officer and also a pharmacologist in this study, and we have Dr. Kalyana Sundram from MPOC as an overall consultant for this program. The sponsors for the phase 1 clinical trial was MPOB and from the Malaysian Ministry of Agriculture and Agro-Based Industry under the Science Fund programs. We obtained the ethical clearance from the Medical Research Ethics Committee, Malaysian Ministry of Health. And for your information, this clinical trial was registered in the Australian-New Zealand Clinical Trial Registry database, and you can log anytime into the web page. You just type our reference number and you can monitor the progress of the clinical trial. Previously, Professor Sinsky from MIT have systematically explained to us how OPP is extracted during the palm oil milling process. So under normal practice, the water-soluble fraction that has been produced from the palm oil milling process was discarded into the effluent. So what we did was we took this water-soluble fraction, channel it into the state-of-the-art filtration system, and that's how we harvested the oil palm phenolics. This is basically the major phenolics compounds in our oil palm phenolics. As you can see, the major phenolics compound in the OPP is the caffeochimic acid, and the total major phenolics in the OPP is ranged between 15,000 to 21,000 ppm/GAE. In the previous presentation by Dr. Ravi, she has carefully documented all the preclinical studies on OPP that has been done in MPOB and in our collaborators' lab. If you have time, you can look through all these 4 literatures that carefully documented all the physiological properties on OPP. We have confirmed that the OPP have an antioxidant role, antimicrobial, anti-atherogenic, anti-cancer, anti-diabetic, anti-hypertensive, like what Dr. Mahinda just presented right now, and also memory enhancing. The rest of it is still in our investigation. So based on the current in vitro and animal studies that we have investigated, we have come with a strong justification and a good rationale to proceed with the human trial. So what we did was last year, we plan a first phase 1 clinical trial using normal healthy volunteers from our organization, MPOB. So the clinical trial was designed with this objective. The first objective was to evaluate the physiological effects of OPP in normal healthy volunteers through the monitoring of several clinical biochemistry profiles. And the second objective is to investigate and evaluate if there is any adverse effect, AE, or serious adverse effect. So out of 95 human subjects that are willing to participate in this study, we have selected 25 healthy volunteers with this inclusion and exclusion criteria. And for your further information, each volunteer was provided with a clinical trial insurance. This is one of the requirements that has been stressed out by the Malaysian Ministry of Health, that insisted that every subjects participated in the clinical trials must be equipped with a clinical trial insurance. So basically, this was a single-blind crossover design trial. These 25 volunteers were divided into two groups, where the first group will receive OPP treatment, while the second group will receive controlled treatment. And they will be supplemented with both treatments for 60 days. And after 60 days, 28 days of washout period were given to both groups. And after the washout period was completed, we switched over group 1 to receive control treatment and group 2 receive OPP treatments. And the concentration of OPP that were used in this trial was 1,500 ppm GAE, 100 ml twice per day, while the control we used drinking water, also 150 ml twice per day. So during the trial event, during the recruitment period, 60 days, there were 3 interventions in each trial round, which was day 1, day 30, and day 60. What happened during this day was we took our volunteers' urine sample. We did an anthropometry measurement. We measured the height, weight, and BMI to evaluate if there is any weight reduction or weight increment resulted from supplementation of OPP or control treatment. And 20 ml of fasting blood samples were taken from each volunteers. During this intervention, we also the medical officers in charge also performed a very thorough medical examination to monitor any signs of adverse effect or serious adverse effects that might occur in our volunteers. And during this period also, the medical officer documented all observation from the medical examination, and also the complaints or any queries raised by the volunteers regarding the supplementation. This is why we need to document all the observation. This is probably will be probably be useful in planning the next clinical trial. And sometimes the volunteers feel shy to inform if there is any adverse effects to the principal investigator. They tend to report to the medical officer because maybe they are not comfortable to discuss it with the principal investigator. So this picture shows us what actually happened during the supplementation day. We actually transformed one of our seminar room into what we call a small cafeteria, where all these volunteers came every morning to drink their OPP or control treatments. Basically, we provided them with a light breakfast. Because they are more comfortable to drink OPP or their control treatment with the breakfast. One of the reasons why we create this situation is to make sure that our volunteers are not feel stressed and of course we must to make sure that they feel happy during the recruitment period. So these are the study parameters that we will be looking into. All these parameters are useful in evaluate if there is any side effects or serious side effects that probably going to happen after the supplementation. And from this study, all these clinical profiles, we can know whether there is a physiological change or biochemical physiological change in our volunteers resulted from the supplementation of OPP. So we have ordinary lipid profiles, clinical biochemistry there. Endocrinology, we measured the serum insulin and plasma glucose. We have the special chemistry profiles, the serum high sensitivity CRP, whole blood HbA1c. We also measure the liver function to check whether they have developed any toxicology side effects. And of course, we're looking into the whole blood profiles through the hematology clinical hematology profiles. We use two-factor repeated measures ANOVA with the time by treatment interaction to detect and evaluate if there are any significant difference between both OPP and control group. And for the post-hoc statistical analysis, we use a Wilcoxon sign rec test. And as usual, values were considered significant at p less than 0.05. And in this presentation, data is presented as mean plus minus standard error means. So for general result, we happy to observe that all clinical profiles value throughout the whole recruitment period during both OPP and control treatment were in normal range according to the clinical reference, and no serious adverse effects was ever reported by volunteers, and we, through the case report form CRF documentation by the medical officer, we didn't find any serious adverse effects. And we found no significant difference of clinical profiles between OPP and control treatment, except we did find a significant changes in terms of total cholesterol value and LDL-C profiles. As you can see, starting from day 30, we can see that the plasma total cholesterol during both control and OPP treatment was increased. But at the day 60, the last intervention, it clearly been seen that the TC level following control treatments was still high and risen up compared to the TC profile in volunteers who have been supplemented with OPP. And from this figure, we can see that the total cholesterol level at day 60 during OPP treatment was significantly lower compared to the control group. We didn't anticipate this finding because the previous animal study didn't show any significant effects in terms of plasma total cholesterol profile. And from the plasma LDL-C level, we can clearly see that at day 60, the LDL-C level following OPP supplementation was significantly lower compared to the control group. But however, we didn't find any significant difference in HDL-C profiles between both control and OPP group. For your information, this profile has been corrected to their baseline value. We also didn't observe any significant difference in plasma triacylglycerol between both treatments. Previously, Dr. Julia from University of Brandeis has demonstrated us with wonderful findings from the diabetic Nile rats model, who shows that OPP has a potential, has a anti-diabetic potential. But in our human study, we didn't find any significant difference between plasma glucose during between control group and OPP group. Probably we don't know what will happen if we prolong the supplementation period to 80 days or 100 days, and probably the concentration of the OPP that was used in this clinical trial is probably low, because if you translated 1,500 ppm GAE equivalent into a body weight equivalent measurement, the dosage that we used in the clinical trials was only 450 milligram per kg body weight. Perhaps in the next trial, we can try to increase the dose of OPP, and hopefully we can establish a dose-response effect findings. So, based on the current phase 1 clinical trials findings that we have now, we can make a conclusion that after OPP treatment, plasma total cholesterol and LDL-C level at day 60 was significantly lower compared to the control treatment, and we are happy to announce that we observed no serious adverse effects following OPP supplementation. So basically, based on this conclusion, it provides us with a good rationale and justification to move further into phase 2 trial and phase 3 trials. So our future plans is to look into individual data, response, and correlation that following OPP supplementation from the data that we have now from the phase 1 trial. And for the future plans, we plan to conduct a series of postprandial study with an objective to evaluate absorption, metabolism of OPP biomarkers in blood and urine. And we're also interested to see how the OPP supplementation influence the glucose response. That's why we are interested. We are intended to conduct a simple study. We want to look into the glucose response after OPP acute supplementation. This can be achieved through the oral glucose, a simple oral glucose tolerance test, OGTT. And of course, like what I have explained before, we want to conduct a dose escalation and dose exploration trial in order to establish a dose response effect. And of course, we want to move further with phase 2 clinical trial with involvement of the healthy volunteers and of course pre-diabetic patient. Probably, of course, we need to increase the number of sample, and we are looking forward to conduct this study. Before I end up my presentation, I would like to acknowledge the Director General of Malaysian Palm Oil Board, Yang Bahagia Datuk Chu Yun Mei, who give lots of supports for the phenolic research team in MPOB, in MIT, CSIRO, University of Brandeis, and Wayne State University. And also to Malaysian Ministry of Agriculture and Agro-Based Studies, because they willing to fund this phase 1 clinical trial. Malaysian Ministry of Health, because they provided us with a lot of advice, especially when it comes to conduct the phase 1 clinical trial. We were informed that this is actually the first phase 1 clinical trial conducted locally, and for the ethics committee in the MOH itself, it was also their first experience evaluating the clinical protocol of phase 1 trial in Malaysia. I would like also to thank our research collaborators in overseas, locally, Malaysian Palm Oil Council, Universiti Kebangsaan Malaysia, Universiti Malaya, MIT, CSIRO, Brandeis University, Wayne State University, and lastly, the important, I think, one of the important things in every human study is we must acknowledge the participation of our volunteers, because they are the one who prepared the starting material of the study, which is the physiological samples. That from that we can see what exactly the effects of OPP in human, because anything can happen in human models. We might see a wonderful effects in the in vitro and animals models, but eventually we have to confirm it with the human data. With that, I would like to end up my presentation. Thank you very much for your attention.
Thank you very much, Dr. Syed Fairus. We now open questions from the floor. Perhaps I can start the ball rolling again with regards to some of your data.